Hi guys, welcome back to another episode of the SOFABOX, your patient education station while you're stuck in isolation. So I hope you've all had your coffee already. We're taking on a bit of a big topic this week. We're talking about low back pain. Okay, so I think we all know, like everyone and their dog who's had low back pain, either currently or in the past. And for me, I see about probably 85% adolescents and kids. And I can't tell you how many kids I've seen, like under 16, that have chronic low back pain. And this shouldn't be a thing, guys. I can understand kind of the older population, and again, it's very prevalent throughout as well. But young kids, I think we got to start asking other questions here. So, my topic for today is just showing you guys all the pieces of the puzzle and how it can also just not be a back thing. There's so many other pieces that could be contributing to the back. And a lot of what I tell my patients is you can't always chase the pain. Okay, so just because there's pain in the low back, that could just be a symptom of something bigger. Okay, and so I'm going to kind of walk you through some of my key questions when I'm assessing somebody with low back pain. And if you're sitting and watching this at home and you're like, oh my gosh, this is me. I have low back pain now. It's been going on forever. Or you know somebody with low back pain, or your daughter has low back pain, please share this video and please get them to watch it in its entirety. Because I'm going to be walking through some questions that you can start asking yourself if maybe a health professional hasn't asked you these already. And you can start kind of taking a mental or a self-inventory of some of the things that maybe you never even considered could be contributing to your low back pain. So today we're going to delve into that little subjective history and then kind of chat on Wednesday about, okay, what are some self-treatment techniques? What patterns did we notice based on what resonated with us today? Okay, so I'm going to pull out my whiteboard here. I almost didn't have a big enough whiteboard. And I probably still don't, because there's things I'm missing for sure. But I always like to go off the KISS principle, the keep it simple, stupid principle. So here are my go-tos for a subjective history. And for those of you who aren't health professionals, all a subjective history means is like when we're talking to you, all the questions we're asking. So we haven't even touched you or looked at movement yet. That would be called the objective history or assessment. So we're going to look at, these are my go-to questions. And if you're a physio watching out there, I hope maybe you can add some of these to your toolkit if you haven't already. But these are guaranteed asked in every single assessment that I do. That's why usually the first time I see someone, it's about 70% talking on my part, asking questions, getting to know the person attached to the back. And I've really tried to force myself over the years to not get so excited about, okay, we got to get up and move, let's watch them move. Yes, that's important, but as you'll start to see, if you start getting answers to some of these questions, you should kind of already know what you're dealing with before you even watch the person move, okay? So patients out there, if you're watching, or somebody with low back pain, I want you to start taking some notes into key things that you hear today that might resonate with you and what's going on with your case. Because then the next time you either see a health professional or talk to them, mention these things, okay? These are all crucial questions if you're suffering from low back pain. And again, for physios, maybe these are more questions you can add to your toolbox if you haven't already. Okay, so the first thing. Ask them what their movement preference is. So if you've been in pain for a long time, it can kind of seem like, I don't know, everything hurts until you start asking these questions. So let's keep it simple. So it would be like, how's bending forward versus leaning back? Do you have a preference? Okay, if they say, oh no, I love going into child's pose, I love sitting, I love like folding forward, I already know, okay, they have a flexion based preference. Flexion just means rounding the spine forward. If they're like, oh no, it like hurts when I'm sitting for a long time, or when I go to tie my shoe, or when I'm putting on pants, I know their back doesn't really like flexion. So I'm going to be kind of thinking, okay, let's go more into extension route. So extension is like leaning the back. Your back might hurt all the time. It might get to the point where, I don't know, everything hurts. But start to notice, does your back have a preference? Does it like more flexion or does it like more extension? Because when we chat on Wednesday about home treatment techniques, you're going to need those little nuggets of information to kind of start piecing together your home program and what's going to work with your back. Again, it's not a recipe for all. It depends on what you're feeling. So I always get a sense of movement preference. What is their back like? Just from what they're telling me. Do they do prolonged sitting? What's their job? What's their activity level? So if I know they're doing desk work, which aren't we all right now, sitting maybe a little bit more than we're used to, the back doesn't like prolonged positions, okay? We're born to move. We're made to move. So any prolonged positions, the back's going to get kind of cranky with. If they're a dancer, my number one question is, are you an acro and does it provoke it? Unfortunately, that's the pattern that I've noticed. If people are at a studio that are pretty high intense training and they're doing like really high emphasis on getting those tricks and repetition of extreme back extensions, I already know that that's a big piece of the puzzle we need to address, is how they're extending their back. So acro, and if they're pretty high intensity, high level athlete, or in particular those that require those extreme back extensions. Here is my number one question for low back pain. And if you're not asking this to your clients, you absolutely need to start. GI issues. So what does this mean? GI means your gastrointestinal tract. And so that could be like anything. Again, you don't need to be a GI specialist to just get a sense of like, is stuff normal down there, or is that something we need to address? So some questions I'll ask is, do they have, like, what's their diet like? Do they have any food intolerances? Okay, so, oh yeah, like I get some cramping if I like eat a lot of sugar. Or no, I'm technically like lactose intolerant, but I cheat every so often and I pay for it. So starting to notice, is your gut happy? Or do you find like, actually, no, I get kind of cramping quite a bit, or no, I'm actually not great about eating the foods that I know work well with my body. If you're getting a lot of gut cramping, spoiler alert, it will start to affect your back. Because if we look at the anatomy, okay, so here's our low back. Guess where your guts sit? Right here, right by psoas. Kidneys are right here as well. So we need to start asking what other systems in the body could be ticked off, because they guarantee relate to having low back issues, okay? My example for that, when people are a little like, really, like, I think you're a little off your rocker, is I give the example of, say, a heart attack. So what is the classic symptom of a heart attack? Is your left arm, you get left arm symptoms, okay? It either goes numb or whatever. There's nothing physically wrong with your left arm. So it's like somebody saying like, yeah, no, like something is wrong with my left arm, even though I got sent to the emergency doctor, but my left arm is hurting, so I think you should check my left arm. And it's like, no, that was just a symptom of something bigger happening in the systems, right? So like, we absolutely need to start asking GI questions. Keep it simple, right? I'm not saying like you need to scope them or anything, but get a sense of like, is stuff normal down there? I've even asked people like bowel movement frequency. And again, I don't know I'm not a GI specialist, but if somebody isn't doing number 2 regularly, like they say, oh yeah, like I go maybe once every 4 days, that's an issue. That's a bit of a red flag. So it's just little nuggets of information that I can put in my back pocket. And if I wanted to go down that road, which I should, I refer them on and note that in my letter. Okay, so GI stuff is huge. Diet stuff is huge. And if you're listening to this at home and you're like, oh yeah, like I have chronic back issues and I'm pretty bad with my diet, I eat stuff that makes me cramp, start being more mindful of what you're eating and see how your back responds. And this isn't going to be like a 2-day fix. You might need to commit to this for a couple of weeks to start noticing a difference, okay? So GI stuff and diet is huge. And I don't know about you guys, but especially in kids, how many kids now have GI issues because our food has changed? So it's a huge, huge question I absolutely am asking in my assessment. The other thing, kidney issues. Okay, and again, I'm not a nephrologist. I don't need to be a specialist in kidneys to, again, just have an idea of like, how many water bottles are we drinking a day? Because the requirement, if you're not an active person, and especially if you're a teen, you know those Swell water bottles, like the regular size ones? You should be drinking 4 of those a day. That's the minimum requirement, and that does not include if you're doing activity. So if you're doing activity, you should be drinking even more than that. So I get a sense of like, are they dehydrated? Because spoiler alert, the kidneys are right by a muscle called our QL, which is basically right here. And I've found, and my friend actually had chronic kidney issues. Like she would tell me like, oh yeah, I used to have like an issue with UTIs or like bladder infections. And when her back was in spasm, yes, we were trying to help the muscles around it calm down, but she ended up finding out when she visited her doc that she actually had another UTI or a bladder infection. And then as soon as they treated that, the pain in her back went away. Okay, so I'm always on, that's always on my radar too, is how much water are they drinking, and do they have a history of like kidney stuff or bladder stuff? Again, because it can refer to the back, even though the back's not the main issue. Okay. Of course, I'm looking at joints above and below. Okay, so I'm gonna look at like, do they have good mobility in through their hips and their upper back? And again, we'll get more detailed with this later, but I'm always going to check as well the joints above and below, okay? Stiff upper back from sitting all the time. Again, my low back is screaming because my upper back is so brutal. So that's when we, again, don't chase the pain, look at what's above and below and in the middle, okay? Family and social supports. This is really key. So I've had a couple of patients before where honestly, the parent's freaking out more than the kid is. This is not helping the situation, okay? So if the parent has a history of back issues, they're going to be a little bit more ramped up if their kid starts to have it. I get it. But pain is learned. Think of when you're little and your toddler falls down for the first time. What do? They look at you for a reaction. So this also pertains to the older population, say like a teenager and her mom. If the mom is like asking all the questions, she's freaking out. Can little Miss Susie perform in this competition next weekend? And the kid's sitting there like literally less concerned. That's not going to help things, okay? So I always get a sense of not just the family supports, but also friends. Again, I had a kid recovering with chronic back issues, and I found out later that her group at her studio, all her peers, were kind of giving her the brush off because of it. This was a studio that didn't have a good culture when it came to dealing with injuries. So she was kind of the first to to kind of step out and be like, look, I'm going to take care of this and I need to modify some of my activities. The teachers were on board, but little did I know she was actually getting a lot of flack from her peers. That can cause increased stress and again perpetuate low back pain. So all of these little things can be adding to that overall piece of the puzzle, okay? So do they have any family support? Maybe their parent doesn't even believe them and they've told them this in front of them. So I'll be taking a history from a kid and the mom says, yeah, I brought her here because I want to see if this is legit or not. And it's like, oh, why would you say that right in front of your child? So again, getting a sense of like, are they supported at home? Do they have a team of people that are on board with their recovery? Because if they don't, it really doesn't add to a good prognosis, okay? Stress. Are they a stressy person? Again, if I know they're high stress with other things, say they're perfectionist at school or at work, I already know their nervous system is going to be really ramped up. And when the nervous system gets ramped up, everything gets really hypersensitive. And again, it can increase your pain. So I hope you get a sense now of how much can go into causing low back pain and how it's really just a symptom. And it can just be, there can be a bit of a deeper issue, if not multiple deeper issues, okay? So I always ask about stress, general health as well. So do they have a history of like stomach ulcers? Again, that is pertinent. If I know they're prone to ulcers, again, anything in the gut, the stomach I've had, refer to the upper back for pain. I treat the upper back and actually the stomach pain goes away. So that's been really interesting for me to note. But again, it takes some digging, it takes some time to do digging about what is your history? What else have you been through? With females, I'll ask about their periods. Do they get a lot of cramping? Does their back pain correlate if they have bad cramps? Usually, yes. So again, that's another piece of the puzzle, is how can we start to develop this program that kind of stops focusing so narrow on it's a muscle thing or it's a joint issue. There's all of these other things. This is key. This is going to transition us into part 2 here. But have they injured before? Okay. Have they had chronic episodes of low back pain? Maybe they've had this forever. Maybe they don't even remember what normal feels like. What is their experience with pain? Are they a young kid? Maybe they haven't even had pain before, and this is actually really scary for them. A lot of the time, it's about pain coaching and just calming them down to the fact like, look, we're going to get through this. It's not the end of the world, especially if they don't have that experience to pull from. Like maybe they did recover and they do know that there's an end to this, or there can be some light at the end of the tunnel. So if they're young or they've never had an injury before, that's huge. You're just going to have to take a different approach in terms of educating them on what pain is and what they can do about it. And again, calming the nervous system down. So, most importantly though, which again takes time, is who is the human attached to this back? That is key. As much as we can be so focused on like, let's watch them move and let's see how strong this muscle is and let's do all these special tests, honestly get a sense of the human attached to the back. That is what makes the program so different, is you got to know who you're dealing with. So, a few questions, okay, and I don't know if you can see this, but I'll kind of read them out. To kind of wrap up today, is I want to give you a sense of some of the things that we call thought viruses. So when we're looking at what person or what human is attached to this body, These are some of the things I'm kind of taking note of as I hear them talk or as I get to know them. Do they have any of these questions or phrases that they've been saying? So, are they stressed about the injury? Do I sense like this is a big deal and they're really getting worked up about like, I won't be better for the show next week or I won't be able to compete next week? That is again going to perpetuate pain. Ramps up the nervous system. I won't be able to walk with my family in Mexico in a month. So I already know like that's a high stressor, is like they have this timeline now that they're dealing with. That can again increase pain. Everything hurts. Okay, so this idea that there's no end in sight and just like, I don't know, everything just hurts. They've almost like given up on trying to question or self-analyze their body. Okay, not a good kind of thought virus. Pain-focused thoughts and behaviors. So if they're always bringing up the pain, when I'm taking a history like, oh, but this hurts, and like, I can't do this so hurts. Every time I talk to them, it's like they're giving me an update on their pain level without me prompting them. Pain-focused behavior just gives me an idea they're kind of on this negative thought virus train, and I'm probably going to need to sway them out of that. My mom had really bad back pain, okay? So again, if they've watched somebody in pain maybe not recover, that's a thought virus. That's going to be logged in their head thinking, oh my God, I'm never going to get through this because my mom never got through it. They couldn't find anything on the MRI. I need a new MRI. Spoiler alert, all of these things that we asked about will not show up on an MRI. GI stuff won't show up on an MRI. Kidney issues won't show up on an MRI. If they're MRIing the low back, okay, they're not looking for that. Again, the social supports, the medical history, these are all things that you can only get from your subjective. The brain attached to this, that will not show up on the MRI, how stressed they are about it. So if they're really concerned about finding something and they've been in pain for longer than 6 months, again, I'm going to need to coach them out of that mentality and start getting them on a new train of thought of, you know what, let's start moving and see what happens. Because movement is the #1 treatment for low back pain. Why can't someone just fix this for me? I'm not doing anything until the pain goes away. Physio made it worse before. So again, if I'm hearing all these things, I'm thinking, okay, I'm going to have to do a lot to, again, target these thought viruses. This is more important than me actually looking at the osteokinematics of their spine, okay? I need to address this at the same time, or if not, prioritize this. Otherwise, we're not going to make much progress in pain coaching. I'm in so much pain, there must be a lot of damage there. Educating people, and this is a huge thing, and this didn't really sink in for me until about 3 years after physio school. Pain does not necessarily mean damage, okay? Especially if you've had pain for longer than 3 to 6 months. And again, stay tuned for more episodes on what that means and some education on that. And this should be in the school system, is what does pain actually mean? They told me I blew a disc. Even the language of how they describe their injury can be quite aggressive. I blew a disc. I popped my knee. My ligament blew out. And unfortunately, these are some of the terms they've maybe heard from, say, an emerge doc or another healthcare practitioner. And I know I'm trying to be very mindful of what language I use to describe things, because it can really take the edge off things. Instead of I blew a disc, it's like, oh, like you strained your back. Very different approach, very different sounding diagnosis than, God, you ruptured your ACL. It exploded. These are all things, think of if you're a kid too, how traumatizing that can sound. I had a kid, and whether the doc said this to her or not, this is what she heard is, oh, he said my ligament in my ankle exploded. Very traumatizing. So again, I'm having to retrain that, give them a new path of thought to get rid of these thought viruses that, again, spoiler alert, if these are some of the things going on in their head, maybe they're not even verbalizing this will increase your pain. These negative thoughts, these negative connotations will perpetuate the pain cycle. So it's not just about what is mechanically wrong with the back, the muscles, and joints. Yes, we still need to look at that, but notice I haven't even talked about that today, and it's all about all the things, all the other things. So when somebody is telling me about their pain, I just picture them holding up one puzzle piece, okay? If you looked at one single puzzle piece, it'd be like me asking, oh, so what's the big picture? What puzzle does this go with? You don't know. It's only one piece of the puzzle. So we need to be gathering more puzzle pieces to actually put the big picture together, and then that's going to be what's going to help direct me towards somebody's personal treatment plan. So if you know somebody with low back pain, again, please share this video. If you have low back pain, rewatch this video and start making some notes of the things that maybe you resonate with or is going on with you. And then let's have a conversation about, okay, what are some things we can do about these things that you noticed? Do you have a lot of negative thought viruses? Do you have GI issues and you're like, been really slacking on the diet here in quarantine, okay? So start making a list. We're going to chat on Wednesday about some home treatment techniques if you noticed any of this stuff in yourselves, and we'll kind of go from there. But just know it is huge. I didn't even cover all of the things, but these are the things that need to be asked and sussed out, especially in a first appointment and every time you see someone thereafter, to again know the human attached to the back. That's more important, I think, than being so focused on a bone and joint thing. Okay, so that is the very heavy soapbox for today. Again, please share this with people, and I'll hopefully be breaking it down into even smaller bits as we go. Okay, have a great day, guys, and we'll see you Wednesday.